Gentlemen, between the ages of 40 and 65, your body is changing, and so is the dynamic in your most private relationships. As a specialist in urology, Dr. Vera Sterling spends her career focused on the machinery of male vitality, the prostate, the bladder, the intricate vascular and neurological pathways governing performance. But the truth is, the most vital organ in the bedroom is the one often neglected, the mind. Are you confusing subtle shifts in your stamina or erectile function with a loss of appeal? Are you missing the unspoken cues from your partner? Many women harbor deep, often intense desires that they hesitate to vocalize, fearing judgment, refusal, or, crucially, a misinterpretation of their partner's own self-image and sexual confidence. It's time to bridge that silent gap. This is not about exotic performance. It's about intimate health, uninhibited communication, and restoring the spark that years of routine and physical changes can dim. The key to a fulfilling sexual life in your prime and beyond lies in understanding the complex intersection of your urological health and her secret language of desire. The anatomy of unspoken. Intimacy. The consultation room, often sterile and neutral, frequently becomes the stage for deeply personal confessions. As a urologist, Dr. Vera Sterling's primary focus is the physical, managing BPH, benign prostatic hyperplasia, diagnosing erectile dysfunction, ED, and treating conditions that compromise urinary and sexual function. Yet, a vast portion of her work involves addressing the psychological and relational fallout of these physical changes. It is a fundamental truth. A man's perception of his sexual performance is intrinsically linked to his identity, and any perceived decline due to age or illness, even minor vascular compromise or shifts in testosterone levels, can create a profound wall of silence in the bedroom. This silence is often compounded by the partner's reluctance to initiate new dynamics. Dr. Sterling has observed, through years of counseling couples, that women in long-term relationships, especially those in the 40 to 65 age bracket, often seek a renewed, more adventurous intimacy. However, they frequently censor their own desires, fearing they might be perceived as criticizing their partner's current abilities or challenging their masculinity, which they know is often fragile in the face of aging. The common refrain in anonymous surveys and therapeutic settings points to several unaddressed, intensely desired experiences, not simply acts, but dynamic shifts in the emotional and physical framework of their lovemaking. One of the most frequently cited, yet unasked for, elements is the desire for role reversal or a powerful, intentional shift in control. This is not necessarily about domination, but rather the intensity of relinquishing the planning and becoming the passive recipient of pleasure. In the clinic, a man presenting with mild ED might be meticulously focused on penetration as the measure of success. His partner, however, is often more fixated on a deeper emotional connection tied to a sudden, potent expression of desire that moves beyond the routine. For her, the kink is the sheer intensity and spontaneity of being taken, a temporary, passionate assertion that sweeps away the mundane anxieties of household management and careers. It reframes the sexual encounter from a task of performance, which only exacerbates the male's anxiety, into an immersive, passionate event. Another unspoken wish centers on sensory exploration beyond the genital focus. Dr. Sterling knows the male physiological drive is often narrowly targeted. For many women, however, the yearning is for a slow, methodical journey over the entire body, incorporating elements of bondage, not for pain, but for the heightened anticipation and focus it creates. The simple, non-constrictive use of a scarf or tie to bind wrists for a short period elevates the importance of touch and the power of the non-genital caress. This shift forces the male partner to slow down, to engage with the limbic system through touch and sight, rather than rushing toward the ejaculatory endpoint. This is especially relevant in urological health, as it reduces performance pressure and allows for pleasure independent of maximum rigidity. The focus shifts from the pressure of achieving and maintaining a full erection to the shared enjoyment of prolonged, sensual connection. The third significant area is the desire for playful exhibitionism or incorporating voyeurism into their private world. After decades together, the fear of judgment is high, but the desire for external validation of their attractiveness remains potent. This might manifest as wanting to introduce a mirror or film their own encounters, not for external viewing, but to validate their own sensuality through their partner's eyes. For a man struggling with self-image due to weight gain or perceived aging, this act can be terrifying. Yet, Dr. Sterling recognizes that a woman suggesting this is actually offering a profound compliment, a declaration that she finds him intensely desirable regardless of superficial changes. The medical relevance here is that psychological health directly influences neurotransmitter release, which in turn impacts vascular flow and sexual response. The inability to communicate these needs is the most frequent presenting problem, manifesting as decreased frequency, increased frustration, and sometimes even the development of recurrent pelvic pain in the female partner. Dr. Sterling frequently advises her male patients that true intimacy in this phase of life is about vulnerability and a willingness to explore these secret desires, not as a reflection of their partner's dissatisfaction, but as an opportunity for mutual, revitalizing growth. Addressing vulnerability and rediscovering intensity. The continuation of the unspoken script reveals that the complexity of desire deepens with the longevity of the relationship. The fourth kinky area, often whispered in the privacy of couples therapy adjacent to urological care, is the intense craving for oral stimulation to be a unilateral, prolonged focus, the complete reversal of traditional effort. Many men, Dr. Sterling observes, are conditioned to view sexual encounters through a performance-based lens, meaning they focus effort on their partner with the expectation of reciprocation. The unvoiced desire, however, is for the woman to be completely and hedonistically prioritized without the pressure of having to return the favor or manage the logistics of the encounter. This is especially true for women balancing the demands of family and career. The act of completely yielding to pleasure is an escape. Medically, this is significant because it shifts the focus from the male's erectile response cycle to the female's often more complex and time-intensive arousal pattern. By removing the immediate demand for reciprocation, the man can relax, which paradoxically often improves his parasympathetic tone and subsequent erectile firmness. If needed later, Dr. Sterling advocates for this intentional unselfishness as a potent form of non-pharmacological ED management, proving that profound emotional connection can be a powerful facilitator of physical function. The kink here is the intensity of sustained, selfless devotion. The fifth secret desire revolves around the use of fantasy and explicit language to heighten arousal. This is often inhibited by years of polite, quiet lovemaking. Women frequently desire the introduction of dirty talk, or acting out shared fantasies that inject a sense of forbidden novelty into their intimate life. This act requires an immense amount of vulnerability from the male partner, as it forces him to use his voice and imagination in ways that feel exposed. Many men in Dr. Sterling's age demographic were socialized to be stoic and silent. The suggestion of engaging in explicit verbal exchange often elicits anxiety. However, the emotional payoff is enormous. It proves that the partner is willing to be fully present, mentally and verbally, not just physically. This type of communication is vital for maintaining sexual health as it keeps the cortical regions of the brain, the centers of imagination and desire, actively engaged, which is critical for overcoming age-related declines in spontaneous arousal. Finally, the sixth and perhaps most complex desire is for experimentation with non-traditional locations or timing, a break from the predictable bedroom schedule. This isn't just about changing the scenery. It's about reclaiming spontaneity and injecting a youthful, slightly rebellious energy back into the relationship. A rushed, passionate encounter against a kitchen counter or a sudden, unexpected intimacy in the middle of the afternoon shatters the routine that can smother desire. This spontaneity is a powerful psychological antidote to the stresses of managing aging bodies and family life. For the male partner, this requires a willingness to drop his guard and embrace the unpredictable. The fear of being caught or the lack of total privacy can itself be a powerful, non-chemical aphrodisiac, triggering a rush of epinephrine that heightens Sensation. Dr. Sterling has consistently found that couples who intentionally incorporate elements of spontaneity, even small ones, report a higher level of overall relationship satisfaction and less anxiety surrounding sexual performance. It reframes sex from a scheduled event to a powerful, intermittent declaration of desire. The core finding of Dr. Sterling's experience is this: these kinky desires are rarely about bizarre acts. They are primarily a cry for intensity, authenticity, and a renewed emotional presence. They represent the partner's need to feel fully seen, desired, and prioritized, especially as the man grapples with his own urological and age-related changes. The path to a thriving sexual life in the later